Good afternoon, and today I have a pleasure of interviewing my friend Dr. Gwen Korovin, who specializes in voice. She's ENT, like a lot of ENT, what I love to bring on my channel because they really take care about the area what help us sleep. We're talking about sleep and breathe in the same time, airway. But what different about my guest? She's the first guest who is ENT, and additional to that, she is a voice specialist, and she help singers, Broadway performance. She helped them with the voice we love so much and easily can recognize when it plays. So among her patients, there is a Celine Dion, Mick Jagger, Brooke Shields, and I'm sure it's much more. Lin-Manuel Miranda, I love him so much, and I love Hamilton. And, I'm a big fan of Broadway and big fan of musical theater, and I'm so thankful for Gwen art and the science, what she bring those voices, what I can enjoy so much. But she's ENT by training, and she's gonna share her story with us. And I'm so thankful to my other friend, Lenore, and her husband, Jerome, who happened to know Gwen and brought her so nicely to the book club, and I met her personally, and now here we are. She's gonna share her expertise with my audience. So my first question to you, what happened? How did you become voice specialist for the voices we love and recognize?
Well, I started out, I did a general ear, nose, and throat residency. And then when I was a resident, I got to meet somebody named Dr. Wilbur James Gould, who was a world-renowned voice specialist. He actually went back to even treating JFK when he was running for president. And overall, he treated actually 9 presidential candidates, which is amazing. 9, yes. And really started, he was really one of the founding fathers of the whole voice world. And people knew him all over the country, all over the world. He started something with a couple of other laryngologists called the Voice Foundation, which still exists to this day, which brings a lot of vocal specialists together, being physicians, scientists, who do a lot of research, voice teachers, voice therapists, singing teachers, everybody. And it's a great organization that really encourages the whole field of voice. And he did an amazing job setting that all up. And I was so fortunate to get to know him when I was a resident. And then when he needed somebody to come into his practice, I started with him. And I just took a love. I had some musical background. I had played the violin when I was a child. I played the piano. I can't say I did that much singing, but I learned a huge amount about singing. And I love taking care of actors and singers. It's really one of my favorite things in the world. Just helping them get back to doing what they love so much, and we all love listening to so much that it brings us so much joy.
That's a beautiful story. But for our audience, besides what you're doing, I want to start with basic, because maybe some people don't know we all value our voice. Voice is such a precious gift, and when the people lose the voice, that's the biggest disaster. Celebrity, president candidate, and I want to mention I read about Dr. Gold, who helped Sinatra and Louis Armstrong with their voices. So, it's something so important. But how physiologically we happen to have voice?
That's a really interesting question, because when you really know the science of voice, we're talking about the vocal folds that sit right here in the middle of the neck. Actually, if you reach, it's like right behind the Adam's apple, more prominent in men than women. So all we have are these 2 vocal folds, and it's just the whole voice really comes from, there's the power source, which is the lungs. There is the vocal folds themselves, which vibrate and hopefully vibrate well. And then the voice is affected by everything else around it, the tissues around it, the throat, the nasal area, everything shapes the sound that we hear. So any of those things, if they're not operating properly, can affect the sound that we hear. So keeping all of those in good working health becomes so important. So really the physiology, it's quite amazing actually that
Yes.
we get the sounds we do from these.
That's so, that's so magical for me. Even, I'm in the area in front of it, I'm working in the mouth, but that's not too far from the area I work. And that actually shaped my next question. How does subtle changes in the nose, in the sinuses, and then the reflux, and a lot of people don't know about that reflux we just discussed, called silent reflux, or LPR,
Yes, LPR.
laryngopharyngeal reflux. We're talking about acid coming from the stomach, and very often in that particular disease or condition, asymptomatic, people think they just have a stuffy nose, or again, they got a sinus, but that affect the voice and endurance. So I want you to talk about neighbors of the vocal cord and what we need to do to make sure we do have a voice.
Yes. Well, I think we will start with the top and work our way down. So when you're talking about the nose and the nasal passages, so many different things can affect that area. First of all, anytime it's stuffy and you have a lot of mucus, that mucus, whether you're blowing it out or it's dripping down into the throat, can end up irritating the throat, irritating the vocal folds. When you're all stuffy and nasal, it's going to affect the sound that's coming out. It can be an acute condition, such as a cold, such as allergies, which a lot of people are suffering from right now. It's a huge issue. And it's a matter of knowing what to do about it, which has a major effect, because there are a lot of medications that people take that are over the counter trying to treat these symptoms, which they don't realize can have effects such as drying or irritating the nose. And if you dry out the nose, that could be as bad as the nose being wet and stuffy. So the nose plays a major role in this. The nose, the sinuses, the resonance, we all need good resonance in order to have our voice working properly. So the nose is a major issue. And of course, if the mucus is dripping down the throat and irritating, that can have a significant effect on the vocal folds, the lungs, the breathing. If you're excessively dry, that can be another problem, as we know. The other thing is that dryness of the throat can be a big problem. So many things, environment, medications, all of that can have an effect on making you feel so much drier. And if the vocal folds are dry, they don't vibrate well. And if they don't vibrate well, it's like a friction, and the vocal folds can end up getting irritated because there's so much dryness there. I mean, we all need some lubrication. We need some mucus to be present, but what we don't want is for it to be too thin, where it's running down, or too thick. So it's a matter of trying to keep that working properly. We all need hydration. Hydration is actually so important. Hydration of the vocal tract itself, hydration of the nose, and hydration of the body. And things such as saline spray and steaming are quite important for keeping that whole area well hydrated. So that's another thing. Sometimes just even nasal rinsing. A lot of people do that just to get rid of whatever's collecting there. People who are very stuffy can become mouth breathers, and then they'll get all dry and irritated. And we know, as you know, in your specialty, if you're if you're a mouth breather, that can have an effect on everything else. Then we move down to beyond the vocal tract itself, that what you mentioned, which is LPR. LPR stands for laryngopharyngeal reflux. It's actually a bit of a different entity. Everything's on a continuum. Most people think of gastroesophageal reflux disease, where they're feeling heartburn and burning and burping and mucus, but you can have a more silent laryngopharyngeal reflux, where what you have is some acid coming back up and irritating the throat. And that can cause you to feel like there's something stuck in the throat. That can cause you to actually clear your throat a lot. It actually can come up and bathe the whole area around the larynx and cause physical irritation. And this is a very, very big problem. One of the reasons laryngopharyngeal reflux becomes so important, especially in performers, is it can come from different things. It can come from the foods we eat. It can come from which are acidy foods or spicy foods. It can come from the timing of when we eat. Like if you eat and then you lie down quickly, all of that acid can come right back up and cause a lot of irritation of that whole area. So that's another thing. And it can also stress. Stress is a big issue. Stress can cause an excess production of acid, and that stress can really affect the vocal folds. We'll see it sometimes. You can see that the back of the vocal folds is irritated. There are cartilages in back of the muscular vocal folds, which can get swollen or red and can be very inflamed. And this can cause a very big problem for people. Singers often have more of a problem with reflux. Again, their schedules can be messed up. Also, even the physical use, singers, speakers, the physical use of talking a lot or singing can have an effect on the diaphragm, which can end up pushing up on the esophagus, and you can have all this irritation going on. And a lot of people are very unaware that they have silent reflux. I have people come in and say, I don't have reflux. I don't have heartburn. I never have heartburn. I never get burning. And you know what? They don't even know that they have it. And it can be a very silent problem.
How do you have to be real Sherlock Holmes. I'm sorry to interrupt you, but the topic you're talking about, it's so close to my heart, you can imagine, because people come to me and they give that term, seasonal allergy. I have seasonal allergy. And I spoke to allergologist yesterday, and she said to me, seasonal allergies cannot be caused by food. And I said to her, but what about food, what irritate and cause this silent LPR, what people not aware, and allergologist said, no, it's not food, so it's outdoor. I actually reflected in my book, which I think when people get on the elimination diet, they become clear. So how you find out with your Sherlock Holmes loop, and how you find that?
Yeah, well, you're looking. I do have to be like Sherlock Holmes. You have to be a detective. When you look, you can sometimes see what's going on, and you can see that there's inflammation behind the vocal folds. Sometimes it's just really from the history. If you spend enough time with patients and you find out what is going on with them, you can actually get a lot of information about where their problem could be coming from, whether it's from up above or below. And sometimes it all lands right in the middle. So sometimes it's on physical exam, sometimes it's just from the history. The other thing I can say, and this is, I've seen this in a lot of patients recently, is, we have this whole culture now of all these people that are on these GLP-1s and tirzepatides, because, I think they're a great drug because they help so many medical problems. But on the other hand, they also have gastric side effects in some people. They cause bloating, they cause burping, they can cause reflux. So I'm also seeing a lot of that. And, everybody wants to look good. Everybody wants to be beautiful and thin, but not at the price of it somehow affecting the voice. So that's another thing that we're seeing more and more these days. And I've had to have people who have to talk to whoever has them on at their internist, their endocrinologist, about possibly changing doses or timing, because we don't want to see that affecting their voice for the long haul. That's another.
That's a very good, it's a wonderful. Thank you very much for saying that. Of course, I do combination treatment for sleep apnea when I use oral appliance. Then, in addition, if patients start losing voice, of course, my treatment gonna be so much more successful. But it's gonna be a price, and it's very hard for patient. And I'm a side provider. I do different therapy, but I observe kind of align benefits and negative side effects of that. It's an art more than a science.
Yes, I think you have to remember everything in treating. Both of us do is both an art and a science. You can know all the science in the world, but if you don't incorporate the art in there, you're not really, in the end, helping the patient.
Yeah, this is beautiful thing. But I want to ask you, what are early warning signs for singers or for public speaker or even for regular people? We all need voice. Doesn't matter what level of fame we represent. What are early warning signs what voice is in danger before it become whole blown?
I think any changes in the voice, certainly singers and public speakers, for the most part, hopefully they've been trained and they know how their voice should function. So that if there's any change, if there's a certain part of the range of their voice that's not working well, that's one thing that they can notice. The other is just, it can be a change in even the way they're breathing. If their breathing is different, that can be something. Vocal fatigue, if they're fatiguing more easily, that's another thing. Sometimes people, and it happens more often than you think about it, will feel a physical pain. They'll say they sing or they speak, and after 20 minutes or a half hour, where they used to be able to go for hours and hours, suddenly there's a pain there, or a tightening. The throat or the voice starts to feel tight. And those are all warning signs that there's something wrong. The other thing is, if somebody's ever singing and speaking and they literally get a sudden pain that they've never experienced, which may be just a 2-second pain, there could be that they've done something and hurt themselves, and they'll keep going on. And as soon as they can stop using their voice and get to a specialist, that's really important, because some people will injure their vocal folds. Some people, you can actually have what's called a vocal fold hemorrhage, where you break some blood vessels in your vocal folds. And if you keep on going, that's where you can really injure yourself, and you can get like a vascular polyp form. So the earlier you go to a specialist, if you're noticing a change as a performer, as a public speaker, that's really important. So going on vocal rest as soon as you can, and then going and checking it out so that you prevent a longer term problem. And, I'm a big believer in prevention. I'd rather prevent somebody from getting a problem rather than have them come in with a problem and then it needs more extensive treatment. So the more conservative we can be, the better.
Yeah, I'm so glad we explored like hidden physiology of voice and how vocal cords, can stay truly protected. But tell me that question, what I discuss with a lot of my patients: how should we breathe? and how performance should breathe. Because a lot of people say to me, I do that because I am performer.
Performers, it's so interesting. And I can always tell if somebody is a well-trained singer, you can actually tell, because even if you listen to their lungs, they have a certain way of really taking in the air and expanding the lungs and lowering the diaphragm so they get a full use of their air. Making sure they can breathe well through the nose is also a very big thing. But a lot of people don't necessarily breathe right. They don't take in a full breath, and they speak more from here. And where you really need to be speaking is from here. You need to speak on your breath. You need to have a good breath support in order to be able to create a voice that sounds good and you don't hurt yourself doing it. And there are actually, voice teachers, voice therapists really are great at teaching you how to breathe well. It seems like something that would be just intuitive, but we don't all breathe well.
No. That's why I have a bread on my table, because people don't know how to breathe. If somebody doesn't know how to breathe and they use mouth preferably, and the tongue position is vogue, but it should, in the best case scenario, rest on a roof, on a palate, but they don't have enough tone for that. And I reflect it all in my book, Breathless. Things what I find amazing, what so many people have no clue about how to breathe. What nose is actually for that particular function. That's a really surprise for a lot of people. And another thing you mentioned about diaphragmal breathing, that's a very difficult, complicated area, but using the nose, because it has a resistance, you have more chances to bring up the diaphragm and, create that whole effect of breathing fully, rather than getting the mouth breathing easily with your ribs. So that being said, because people don't breathe well, they have a lot of sleep apnea.
Yes. And when they have sleep apnea, they're definitely not breathing well. They're drying out, and that's another thing that can end up really affecting
the voice.
It doesn't necessarily affect the vocal folds directly, but all of the tissues around it. So it's all so important. It's like keeping everything from the nose all the way down to here.
You have a big area to address. So this is my last question. If you can give 5 good suggestions for people who need the voice and want to save the voice, what should they do?
Okay, so I think the first thing is, and I was just going to take my own sip of water, hydration is one of the most important things. Drinking enough water throughout the day. Also, steaming can be very helpful for that. So the breathing and, keeping hydrated is one thing. Rest for both the voice and rest for the whole body is so important. Getting enough sleep, taking time to just not use the voice so much. We all sometimes we feel like we need to always fill in the gaps and be talking. And there are times that it's better to be silent. And that is something very, very important. Exercise is very important, especially aerobic exercise, so that you can keep the lungs going, working on that. That's a really important thing. So yes, let's see.
I think you gave 5. I think that's all good. And you're a great example of physical exercise. So thank you very much, Doctor. We really appreciate. And I really love how you point out the importance of nasal and diaphragmatic breathing. And hopefully my audience now gonna use your advice and have a beautiful voices, either they singers or public speakers or just regular people who we always need to express ourselves. And this way it's a beautiful way of expression.
Yes, yes, yes. I think that it is so important. It's not only, I mean, the advice that we've been talking about is not only for performers and public speakers, but really for the general population as well, because for most of us, we need to be using our voice no matter,
Field.
almost no matter what profession we're in.
Yes. Thank you.